All right, thank you everyone for joining us today on our Grad Talks Public Health webinar. We're excited to have some great panelists for all of our scholars to learn from and gather some more information in their graduate journeys. So without further ado, we can get started. First, we'd like to do some introductions of our GMS API ASF staff. My name is Melissa May. I'm a program manager here at GMS API ASF, and I've been on the team for about 3 years now. And maybe we can go to Helen next.
Hi everyone, Helen Beaudreau here, Director of GMS API ASF. Just wanted to say that we're really excited about today's webinar, and a huge thank you to Sarah Diane, Michelle, Kevin, Mizang, and BT. Looks like we are coming from we've covered a lot of time zones here, so thanks to everyone for staying tuned.
And we can go to Ariane next.
Hi everyone, this is Ariane Martin. I'm a program manager with GMS API ASF, and very excited to have you all on our webinar and get some good information, and please ask questions.
Let's go Leangelo next.
Hi everyone, I'm Leangelo Kuna. I am a program assistant here at GMS API ASF, and I've been here for almost 2 years now. I'm really excited for today's, webinar and all the experience and the knowledge that is gathered here in this one space. So, yeah.
And Colin Dione.
Hi all, it's Colin Dione here. I'm the Campus Engagement Manager for the Northeast region, and this guy over here is little Kian. He's the youngest GMS scholar. There we go. And I'm really excited to talk a little bit about public health, because it is one of that and education is one of our popular fields.
Great. Ariane, you want to go to the next slide? Yep, cool. Okay, so just to give you an overview of how the day will go. First, we'll hear from some admissions representatives, Sarah Diane Sadowski from Johns Hopkins, Michelle Azarine from UC Berkeley, and then Colin Dione, our API ASF GMS staff campus engagement manager, will talk a little bit about financial aid and GMS. And then we'll take questions on for those three presenters. Then we'll move into some GMS scholar perspectives, and we'll have a panel of 3 of our scholars, BT Zhao, Kevin Lee, and Mizang Chu. And then we will move into some more Q&A.
Okay, so our first person will be Sarah Diane Sadowski. Do a little introduction, and then she'll have a little bit of PowerPoint information. So Sarah Diane is the Communication Associate for Admissions at the Admissions Office and Student Affairs at Johns Hopkins Bloomberg School of Public Health. Her job has made her a public health fanatic, and she enjoys slipping in public health fun facts into conversations. So Sarah Diane?
Hi everybody. My slides, can you let me share my screen? It says I can't while you're sharing.
Okay. Share. She has to share the slides. I'm going to get out of our.
Okay. Let's share. Is she able to start?
You have to stop sharing your screen so I can share mine.
Okay.
Okay, there we go. So I'm assuming you can all see my slides now. So for any really public health degree, what most admissions committees look for is the public health related experience. That can be from classes in undergrad, graduate school if you're looking for a PhD or DRPH, participation in research projects either on campus or at a local organization. Anything that really has helped you discover passions in public health. So whether it was an experience getting a vaccine, which is one of my personal soapboxes, or working at a local garden in a city has a food desert. So anything, or just even fighting policy, anything that really sparks your passion for public health, those are the things we want to learn about in your application. So a lot of times that comes through in the personal statement. We like to see how you've been involved in those situations. Anything that counts as really experience can be volunteer or work experience. So whether it's volunteering in a hospital, health clinic, or a part-time position or full-time position, a lot of different things can actually count as public health experience. It is really important before you apply to do your research. All schools are different, much like with an undergrad experience. You've only seen one school, if you've seen one school. So whether you want a large institution, small institution, CEF is the consortium of public health schools, and their accreditation is really important to have. Here at the Johns Hopkins Bloomberg School of Public Health, we do have an MPH program. It does require 2 years of post-baccalaureate public health experience, and that must be paid and full-time. You will see across the country a lot of MPH programs. It's pretty split, and it is because students like to, or programs like to have students coming in with some kind of background, and this is to help them get further into public health. For the School of Public Health here at Johns Hopkins, we do have combined degrees as options as well. At the School of Public Health at Johns Hopkins, we have many master's programs, and that is going to be true of most schools of public health as well. Specifically at Bloomberg School, we have a lot, everything from the Masters of Arts in Public Health Biology, Master of Applied Science, Master of Bioethics, Masters of Health Administration, Master of Health Science, Master of Science in Public Health, and Master of Science for the SCM. So the difference is that an MPH, that's your one common public health degree across all schools. Everything else, everybody's going to call slightly differently. The MBE, the Master of Bioethics, that's pretty much about ethics with public health. Your MHA and your MSPH here at the Bloomberg School, that is really in-depth study with 4 terms of coursework, as well as a 3 to 6 month year of field placement. So you can actually apply what you've been learning. The MHS is 1 year of research and coursework, and it's really if you haven't had research experience, while the SCM is very hands-on. You do have a 2nd year of classes where you have original coursework. The Master of Arts in Public Health Biology, that's an interdepartmental degree and online, and great if you haven't had a lot of research experience. While the Master of Applied Science, a lot of these are more designed for working professionals. It's completed fully online, and we have a great variety of options.
Great, and I just wanted to add before we jump into Michelle's presentation that I want to plug the public health deferment option. So for all GMS scholars, like Sarah Diane mentioned, needing full-time work experience within the public health field, that is why GMS allows up to 3 years of public health deferment, so you can put your GMS award on hold while you're working full-time in the public health field.
Okay, thank you, Melissa. All right, we'll go on to our next wonderful presenter, Michelle Varian, Diversity Outreach Coordinator, Dream Office from the University of California, Berkeley School of Public Health. Michelle, after graduating from UCLA with a degree in neuroscience, she obtained an internship with the Riverside County Public Health Department on the Kaiser Heal Zone initiative. She then volunteered with the Berkeley versus Big Soda campaign to pass the nation's first soda tax and spent her summer internship working on projects related to food access, local food and urban agriculture policy, and community engagement. Michelle also loves to help students navigate the field of public health in graduate school, which she has been able to do in her current role. Michelle?
Hi, everyone. Thank you for having me. Thank you to the GMS and API-ASF staff for organizing this. So today I'm going to be talking a bit about careers in public health. This slide I have up may be oversimplifying things a bit because there's honestly so much that you can do with a degree in public health. Convinced that there's something in it for everyone. It's just a matter of figuring out exactly where you fit. So when thinking about career paths, I think it's easiest to think about the different areas of study that you can pursue in public health. So on the left-hand side, I've listed the concentrations that we offer for our master's program here at UC Berkeley. And then think about which domain you see yourself operating in within that. So this Venn diagram on the right-hand side has research, policy advocacy, and programs. So to go over those three domains, research really forms the foundation of all of the work that we do in public health. It's necessary for providing the data that we have to justify the policies and programs that we design and implement to protect public health. Research at its core are the areas of epidemiology and statistics. If those of you on the webinar haven't taken those courses yet, epidemiology is about understanding the distribution and frequency of disease, and asks those essential questions about what populations are getting sick and why, formulating hypotheses based on existing literature, designing, qualitative, quantitative, or mixed methods research studies to test those hypotheses, and then using, biostatistics to analyze the data and distill all of that information that we have down into numbers and information that we can share with the public. Next, our public health research is necessary for informing the policies that we design. So policies can exist on the federal level, like seatbelt laws or the Affordable Care Act. And then we have state policies like, Prop 1, which just passed here in California a couple weeks ago, to provide resources to increase supply of affordable housing for vulnerable populations. And then on the local level, you can think of policies like soda taxes or even non-smoking policies on college campuses. So there are public health professionals that need to design these policies, people who go to, Sacramento and DC to speak to legislators and politicians to include these policies on our ballots, and then community organizers that we need on the ground, canvassing, phone banking, kind of building community around these, to encourage people to get them passed, and just kind of spread that information. And then lastly, in our last domain, we have programs. So, the research that we conduct, the policies we design are necessary for informing the programs that we implement. You can think of programs as things that provide resources or direct services to individuals and communities who need them. And, examples of these are Supplemental Nutrition Assistance Program, which is the federal food stamp program, or, all the way down to the local and community level, like diabetes management classes at your local neighborhood clinic. So there are people who need to design these programs, implement and administer them, and then evaluate them to make sure that they're having their intended effects. So our areas of study in public health fall into all of these domains. So you can be, a PI for a nutritional epidemiology study, or you can be a policy research associate focused on environmental justice initiatives, or you can be a program manager or communications coordinator for a maternal and child health or infectious diseases program. So kind of think about, what are the health issues that you're interested in tackling as a future public health professional, and then think about what level you see yourself intervening. So do you really like doing research? Do you really like the policy side of things? On the next slide, to kind of talk more in depth about where our oh, sorry, I forgot to mention. So on the right-hand side of that slide, there's a book cover for 101 Careers in Public Health. It's a book by Beth Seltzer. I would think that it's available on Amazon or, Barnes & Noble or something like that if you want to pop in and flip through it. But it goes over a lot of different job titles in the field of public health, as well as a description of what the job entails and average salary ranges. If any of you are Berkeley students, I'm not sure, we have a copy here at our office. You can contact me after if you'd like to take a look. So on the next slide after this, the actual next slide, I have a screenshot here of where our alum went on to work in 2017. You can see that 30% went on to work for healthcare systems. Actually, if you wouldn't mind clicking through, I have kind of as I go through each one, sample organizations. Yeah, so for healthcare systems, places like Sutter Health, Kaiser Permanente, which are large-scale hospital systems, and then also people going on to work for federally qualified health centers, like, you know, small clinics like the Mission Neighborhood Health Center out in San Francisco. 18% working in research for orgs like Nutrition Policy Institute, Lawrence Berkeley National Laboratory, UCSF, as, you know, study coordinators or even, you know, PIs working in academia. Next, we have nonprofits, 11% going on to work for organizations, Policy Link, Homeless Prenatal Program, California Poison Control System. Sample job titles are consultants, analysts, grant managers, program fellows, policy analysts. And then next, we have a number of folks who went on to work for corporations. Some people co-founded their own or do business operations for them or work as research scientists for orgs like Fitbit and Omada Health. 17% people, I'm lumping all of these together, but 17% people working for county, state, and federal health agencies like the CDC, departments of health, both at the state and the county level. And then a small percentage of people working in biotech at places like Gilead and Genentech, and then the rest working in education or consulting. As you can see, there's really so much that you can do in public health, and I know this is a lot and might feel really overwhelming to think about kind of what your career goals are in the field. I think my #1 recommendation would just be to try to connect with people who are currently working in public health. That's what I did, and it was essential in even figuring out what kinds of programs I wanted to apply to. It was important for me to think about what my goals were as a future, you know, professional. So connect with people on LinkedIn, or connect with me, and we can, you know, put you in touch with some of our current students and alum if you want to see what they're doing and more about what their day-to-day is like. Informational interviews are essential for figuring that stuff out. So please feel free to reach out to me after this if that's something that would be helpful to you.
Thank you, Michelle. And next person, our own Colin Dione, is going to talk a little bit about the Eventually GMS graduate funding cap. So Colin D.
Sure. So hi all. What I'll be talking a little bit about is just the process between graduate funding for GMS scholars. Once received, even though you are receiving full funding from GMS, some programs cost more than the actual funding GMS allows. So because of that, what I would recommend is looking for graduate assistantships on campuses, but also planning ahead. So, and evaluating what funds you have readily available if you are looking to do receive funding for outside funding from GMS. GMS cap is around $46,000 for our private institutions and $40,000 for public institutions. Please note that for public institutions, if you are not a resident of that state, you will be paying out-of-state tuition, and the cap is still $40,000. It's really important also to note that with graduate school funding, you are considered an independent. So even if you're no longer, even though your parents file you for taxes, since you're a graduate student, you still are considered an independent applicant. So please keep that in mind when you're applying to graduate school. The last thing to also note is we mentioned, a speaker previously mentioned that you need to work for 2 years. Please note your income will impact what your FAFSA will allow, so, and would qualify for what GMS could fund. So just there are multiple factors here, and it's extremely important to do your homework on how much the cost of not only the tuition for the school is, but also for what the cost of living is in that city. If there are any questions, please feel free to put them in the chat. And back over to Melissa and Ariane. Is there anything else you'd like me to cover?
No, the only other thing I was going to reference is the graduate program inquiry form. So for all scholars that are looking to go to graduate school, you will need to submit a graduate program inquiry form to make sure that the program that you're interested in is GMS fundable. So make sure that you submit those forms before you submit your applications, because you want to make sure that the program is fundable before you go ahead and apply for it. So just plugging that, and then also wanting to note that when you start looking at interdisciplinary or dual degree programs, if you're looking to do a dual degree, both of your degrees need to be within the GMS 7 funded fields. So you couldn't necessarily do a combined MPH and MBA. Both of your degrees, if you do a dual degree, need to be within GMS's 7 funded fields. Okay, then just wanted to invite any questions into the group chat for our first 3 presenters.
Sorry, and also real quick, you can do an MPH MD. The MD part would be on deferment.
Exactly. So if you apply to a combined MD MPH program, while you're doing your MD classes, you'll be on GMS deferment. And then when you're taking your MPH classes, you'll be GMS funded. But one thing to note is when you're applying, it needs to be a combined MD MPH program. You can't do the MD portion and then, decide to do an MPH portion after you finish your MD. Okay, so we can move on to our scholar panel next. Okay, so I'm really excited to introduce our amazing scholar speakers that we have for you this afternoon. I'll start out with BT Doe. Just to give you some background, BT's mission is to lead people, organizations, and communities to redefine what is possible and achieve powerful outcomes. She's worked in global family planning, advocacy at the Bill and Melinda Gates Institute for Population and Reproductive Health, and in grant making for 4 years at the Seattle Foundation. She applies her creative approach in everything she does, from designing project management systems to creating a bright workplace. And she received her BA from Whitman College and MPH from Johns Hopkins University, and then her BA in sociology from Whitman College. So we're really excited to have BT joining us from Rwanda today. So we'll hear more about that from her.
Thanks,
Our next
Melissa.
Our next scholar is Kevin Lee. Kevin is a current Doctor of Public Health student at UC Berkeley and is interested in operationalizing the effects of structural discrimination on immigrant health, focusing on immigration and labor policy. He also works at the County of Marin Health and Human Services, where he develops programs and strategies to improve the health of communities living with and at risk for HIV. Previously, he's conducted research and evaluation related to sex and labor trafficking, financial savings behavior, and access to health among underserved communities. He also received both his BA in Ethnic Studies and Psychology and MPH in Health and Social Behavior from UC Berkeley. And lastly, we have Mi-Zung Chu. She is a PhD candidate in Population Health Sciences at the Harvard T.H. Chan School of Public Health. She studies environmental and occupational epidemiology, and her research focuses on drivers of air pollution, indoor and ambient, and housing exposure disparities within immigrant communities in urban settings. Prior to pursuing her PhD, she was a CSTE CDC Applied Epidemiology Fellow and later an epidemiologist with the Massachusetts Department of Public Health. She holds an MSPH in Environmental and Occupational Health and Epidemiology from Emory University and a BA in Neuroscience from Smith College. So lots and lots of public health knowledge and background among us today. So I just want to start out by asking each of our panelists to answer one question, or our first question, and that is, what motivated you to pursue an MPH, and what continues to motivate you? And whoever would like to start can start.
Hi everyone, this is Baltram BT for short. I'm calling from my hotel room in Rwanda and it's 11 p.m. here. And I did a master's in public health because I really saw myself as a generalist and caring about a lot of different things from access to healthcare to affordable housing to climate change. And I thought that public health would give me a great systems approach to addressing these issues. So I know that there was an admissions person from Johns Hopkins that just spoke earlier, and I know some of you might be in the process of applying and thinking about what kind of schools you want to apply to and how you want to frame your candidacy. And I wanted to share that I was really surprised when I got into Johns Hopkins because I struggled a lot in my undergraduate studies. I had like a 2.9 from my undergrad and didn't think that like I would get into graduate school, let alone a top public health school. So there's hope and a lot of truth in what was shared earlier, that your professional experience really matters as well as how you frame your story. So for me, I started as a community organizer, doing voter registration in the health clinics. And then I worked in philanthropy as a grant maker for 4 years. And I really think that I needed those 4 years of that professional public health experience because it really strengthened my application. And I also didn't do well in the GREs either. So I'm pretty sure that it was a combination of the professional experience and the community volunteer work, as well as a strong story demonstrating why public health. And right now, as a generalist, like I went from more domestic work, very local to the Seattle area, to doing more global health work in family planning. And that option is available to you when you go to graduate school. You can kind of dabble in a lot of things. And the reason I decided to do that is Bill and Melinda Gates has a lot of investments in family planning. It's a priority strategy for them. And following my values of using public health and family planning as an anti-poverty tool, as well as a mechanism to empower women and strengthen families and nations. And yeah, I think that I'm really excited for that piece, and glad that public health allows you to work across these different areas.
Thanks.
Hi, everyone. This is Kevin. Thanks again, GMS, for having me on here. As far as what motivated me to pursue an MPH degree, I think my route was pretty circuitous. I think like a lot of people, I actually initially was pre-med and was thinking about going into medicine. I don't think when I was in college or in high school, I understood what the concept or what the field of public health is. And as Michelle had talked about, public health is really broad and really fits into a lot of different work fits into public health. And so I didn't have a great understanding of that. However, when I was in college, I got very involved in student activism and student organizing. And so working on issues related to access to education, I think I was exposed to a lot of issues that were very pertinent to not only API communities, but also communities of color, immigrant communities, poor communities. And I think, really developed kind of a political consciousness through the student organizing that I was involved with, but also through the coursework that I was taking. I was an ethnic studies major, and so really thinking and talking and about race was a really critical part of that learning process. And so I think with that in mind, I had always had an interest in working with marginalized and underserved communities. And I think given my interest in health, through the medicine piece, I kind of found public health through different volunteer opportunities. I had volunteered at a clinic initially where I was providing and conducting HIV tests and doing outreach related to HIV and sexual health. I then eventually at some point started working for a federally qualified health center or a community health center that served primarily Asian immigrant and refugee populations. And was doing a lot of programming related to HIV prevention. But I think during that time, it really dawned on me that, you know, of course, my interest was really in public health because I was more interested in population health, which I think that's what public health really focuses on. So not just individual health, but on communities and on a population level, but also primary prevention. So whereas, you know, medicine might focus on treatment or really addressing an issue or disease when it's already occurred, I think public health oftentimes tries to look more upstream at thinking about how do we even prevent these diseases from happening. So I think as far as the program plan implementation or the programming that I was doing and the programs that I was running were really beneficial for my learning experience, but I think I didn't have a great sense of whether it had any impact, and I wanted to know what was the impact of the work that I was doing. And so I was interested in finding public health program because I wanted to better understand what the effects were and to be able to better evaluate and have that skill set to evaluate programs. So yeah, that's kind of a really good reason why I went back to school. So really to develop that skill set and to learn more. And I think as far as what continues to motivate me, I mean, I think initial motivator was really just the understanding that there are a lot of people at risk, you know, for different health reasons. And oftentimes when I think about health, you know, it's such a complex issue, and everything that everything in our lives influence different health outcomes. And I think that understanding that and knowing that health is all around us and is naturally embedded in everything that we do, I think that it's a really important piece of you know, what we can be doing as people interested in public health, especially since I'm really interested in racial health equity and really ensuring that you know, there are equitable health outcomes for people of color and immigrant communities.
Thanks, Kevin.
Hi, everyone. Can you hear me?
Yep, we can hear you.
Okay, great. Hi, everyone. Thank you so much for this opportunity, and also thank you, Kate, for the amazing funding for my master's and my current PhD program. So I'll touch a little bit more on my motivation for getting a master's in public health, and that's where you guys are at right now. And I think it's important to not just think about academic interests, so why I pursue an MPH, but really think about your personal story. For me, I've always been, like growing up, my dad was a community health outreach worker for TB immigrants, especially among the Vietnamese community. My family and I immigrated to the US and Vietnam when I was 5. And so I think that really implanted in my mind the importance of public health, and that was public health practice. And at Smith College, I studied neuroscience, and in one of my seminar in Parkinson's disease, we were asked to write a proposal to study what are the causes of Parkinson's disease. And it was really fascinating to find that environmental exposure, like pesticide exposure, especially in the reproductive prenatal period, could really have adverse health consequences later on in life and in the development of Parkinson's disease. And so I think like that helped frame shift me to understand cause of poor health, not just in a clinical sense, but in a macro level. And it introduced me to the power of environmental health. Environmental health is not just about recycling, it's not just about conservation, but really thinking about the place we live and the place we work and our commute from work, home, and recreational activities, and all the different exposures that interplay from pollutant to like the social determinants of health. And so I think for me as an immigrant, and my family as an immigrant, we had to oftentimes make choices to work and then like to work multiple jobs, but within the workplace, you have hazardous exposures in which it's very difficult to control, right? Because at the end of the day, you want to put food on the table. And so just witnessing that within my community, within my family, and being from a Vietnamese community in which the nail salon industry is very predominant, in which the workers are predominantly Vietnamese women of reproductive age, just seeing that as a very good source of income for our community, but also as a site in which there might be hazardous exposure. And so I think the complexity in which public health allows us to explore is like the social determinants of health, right? And the interplay of hazards, but also what are the benefits. You need income, but at the same time, what is the risk that you're taking? And so I think public health really allowed me to put myself in this sphere to ask these questions. And public health is a really fun space and which is very interdisciplinary. I come from it from an environmental occupational health lens as well as epi lens. But really to answer the questions that you want, you have to like reach across the aisle. And so when after Emory, I worked at the state health department within the occupational health surveillance program. But oftentimes a lot of the conversations that we wanted to have or the initiatives that we wanted to implement within occupational health, we had to talk to like the asthma program, the Bureau of Community Health and Prevention, right? And so I think, and that is another source of motivation for me now that I'm in the field of public health, that once you're in this field, like there's amazing people doing great work in this field, and that continues to motivate me. So when I was at the state health department, I think people really care about making a difference. And then I think in the government level and the more local you go from federal, state to local, the more that you're connected, I think, to your constituents, the community. And you can tell that people really want to make a difference. So I think meeting folks like that and having these real conversations continues to motivate me within the field of public health. And I think the other source of motivation is now that I am in this PhD sphere, oftentimes you could feel disconnected with why you got into public health in the first place, right? To make a difference, to address these social justice issues. So it's important for me to see myself not just as a student, but also I'm a resident of a community, right? I have agency in that aspect as a resident as well. So I think in the third year of my PhD, I really wanted to challenge myself to grow in that space as well. And so I study air pollution, indoor and outdoor air pollution, as well as what are the housing conditions that mediate, that modify air pollution exposures, especially among communities, low income, racial, ethnic minority communities, immigrant communities. And so being in that community setting myself as a resident, I started to kind of look around the landscape within my neighborhood and understand what are the NGOs, what are the organizations fighting for affordable housing, right? Fighting for public, safe, healthy spaces, and really connecting with these organizations, not as an academic researcher, but as a resident and as someone who like care with them as a community member. And I think that has really informed and helped me to stay in this field of public health and really helped me motivated while I finish cranking out, my dissertation and like writing papers. It's really important to be connected at the ground level to public health, because public health isn't just studying it, you have to live it. And you live among it, and you have multiple avenues in order to make change, not just in academia. So yes, that's it.
Great, thank you so much, Mizan. Okay, so moving into our next question for our panelists, what are some strategies for success when working or studying public health?
So I would say that you need to decide whether or not you want to go for breadth or depth. For me as a generalist, I wanted something more broad rather than go into one specific issue area. And I think it's possible to move between those areas and develop different expertise when it comes to topics. So I think that that piece is important. Also, I wasn't sure if I wanted to do an MPH as someone that wanted just more general hard skills, but I saw that there were opportunities in public health to kind of have that more broad approach of certain modules that you can get, like program evaluation or learning about systems or policy and advocacy. So there's different areas within public health that you can kind of gain some of those skills that you're looking for. And also there's opportunities if you decide to apply for an MPH in a certain department or to get a concentration in a school's offerings to specialize in that sense.
Okay, I can go next. I think one thing that some folks have really mentioned, one thing that people may have mentioned, but I think it's really important to really explore what that what your passion is within public health. And that passion may not necessarily be like, you know, what we traditionally think of as health. And so it doesn't have to be, I'm really passionate about heart disease, or I'm really passionate about cancer research. I mean, I think anything that you're passionate about, I'm sure there's a relationship to health somewhere there. So I would, say, really explore what that passion is. With that said, I know that something that people have really emphasized, and I would underscore, is work and gain experience, because that is really going to provide perspective as far as what developing that passion, but also helping you understand the context of how public health operates. And so I think that it's very different to understand public health from, you know, say reading like a textbook versus actually working in the field and understanding the complexities of health, how organizations operate, how they, you know, really interact in how systems interact. And so I think those are all really important learning experiences that can only be gained through work. And I think it really also depends on the type of program that you're interested in applying. I know that for me, the health and social behavior program at UC Berkeley did, most of us did have more work experience, or, you know, at least 2 years of work experience. And for that reason, you know, that actually really enriched the experience. And so I think thinking about what programs you're interested in, thinking about what schools you're interested in, but also thinking about what do you contribute as someone who is going back for your graduate degree, and what do you want from your classmates. And so I think that that's something important to consider. I think finding and developing community is important in grad school, and just really understanding that that's your support system for the next couple of years. And then finally, I think we're all in a very fortunate and privileged place as GMS scholars, because that means we don't have to hold as much debt as some other people, some of our peers. So I think because we have this scholarship opportunity and this funding opportunity, it really provides the opportunity to explore different internships, fellowships, and work throughout your graduate career. So I would highly encourage that, you know, if you have an MPH program, that don't just, you know, get stuck in like the coursework, but really branch out and develop the skill set. And I think that will really set you apart on the job market, or, you know, future things that you want to do.
And I would totally echo what Kevin said. This is really great advice, just to keep your heart at the center of what you're studying. It's really important, because I think you can get lost in a very in an academic environment. It could get really competitive, and everyone who's accepted is doing interesting things, right? So your voice and your interest can get lost among all the voices. And if you guys have heard of like imposter syndrome, you're gonna experience that. But just know that once you experience that there's ways to recover from it too, and there are also other people who feel the same way. And so I think as far as like strategies for getting in first, I wanted to say the sooner that you could talk to faculty, identify individuals that you would want to work with and do research with, the sooner the better. Because I think those are the ones who will be advocating for you when they're sitting down reviewing your application for admission. So the sooner that I have conversation with them. But these conversations will also inform whether you want to work with them, whether this is the right school for you. And once you're in the program, I think it's important, like Kevin said, to really continue to broaden your network and not just study, but like talk to folks. Because there's going to be some days in which you're going to be like, this sucks. And then if you talk to someone, they're going to feel the same thing. And then you talk about why, like what is it that I need right now? And oftentimes you're going to be able to find commonalities. So for example, I don't know, it's been difficult to find spaces to talk about environmental justice issues and so just talking about it with my fellow classmates, those are issues that they care about too. And so we are part of this environmental justice student organization together. We're helping to organize a conference for this spring. So I think that kind of things like that can come organically, these collaborations, identifying people that shares your interests and your concerns, if you just like talk about your research.
Great. Thanks. Okay, so we will move into our last prepared question, and then we'll take questions from the audience. So our third and final question is, what are your long-term career or academic goals?
So since receiving the Gates Scholarship in 2009 when I was 18, like most of us, at that age, my dream has been to work at the Bill and Melinda Gates Foundation in Seattle, which funds our scholarship. And it's been almost a decade, and everything I've done has kind of been in service of that goal, in terms of working in philanthropy and working at the Gates Institute. And I learned that there's 20,000 Gates Scholars, and there's only 4 of them at the Gates Foundation. And 3 of them actually come from an education background, while the global development and global health budget is one of the largest. So I think there's a lot of opportunity for us, and I am really excited. I'm a finalist for a role at the moment, and I'll let you all know if it works out. And I hope that there'll be more of us there, because I really believe that we are the ones that have received that investment and have gained all these great skills to be able to contribute at that level. So yeah, I will be in touch with you all and hope that there can be more of us at the Gates Foundation.
So I'm a first year in my DRPH program, and it's maybe about a 3 to 4 year program. You know, as far as my academic goals, it's to graduate the DRPH program, which, you know, is a few years down. But what I'm really interested in, as mentioned before, is I'm really interested in really developing research and doing work that's related to structural discrimination, because we know that racism impacts health. It has a direct effect on chronic stress, and, you know, can therefore really impact people's health. And so, but I mean, understanding and studying structural discrimination is a little less understood, I guess. So, I mean, that's what I'm really hoping to do, is to better understand how we can really measure that. And so, and therefore, through the measurement, actually be able to use it in applied context. Following my doctoral program, I'm of course hoping to get into the workforce, and I really want to do work that is at the intersection of research and practice, and that's really what the DRPH program trains you to do. So really doing applied research, either at on a local level, at a, you know, local government, or possibly at a policy think tank, to really influence both how programs are developed, but also to influence policy decisions as well.
Yeah, for me, I'm a 3rd year right now in the doctoral program, so graduation is soon. So that would be one of my first goals, to graduate. But I think not just to graduate and finish my dissertation, but to be able to leave with a good network. I'm very interested in academic, government, and DO collaboration to identify. So my research areas in housing conditions, neighborhood conditions, as well as like air pollution within the home and outside. So there are local public health agencies in Boston really interested in this, and really interested in developing affordable housing, safe and healthy housing. So it would be wonderful for me, hopefully, to be able to develop those collaborations now, and be able to transition once I graduate and really work in the applied public health setting.
Fantastic. Thank you all for answering with such insight for all of our panelists. So now I'd like to open it up to questions from the audience. So if you'd like to put your questions into the chat, then we can go through and ask our scholar panelists.
Hi, Melissa. This is Colin D. I want to just actually one question that came up a couple of times. If the scholars Sarah Diane gave us a great definition of what the difference between a DRPH and a PhD is. But if the scholars can just go a little bit more into depth of what their experiences are as students of DRPH/PhD students.
Sure, I can go first. So again, I'm in the DRPH program, and the DRPH program is a doctorate level program, which means that we're expected to do rigorous research. Within a doctoral program, we're expected to do a dissertation. I think one of the things about the DRPH, like I said, is it's very practice and research oriented. So it's for people who are interested in applied research and research. I mean, PhDs don't have to be within academic settings, but I would say that with the DRPH program, it really trains people to think about research in an applied setting. It tends to be, it might depend on the program, but DRPH programs tend to be for people who already have their master's. And so often, at least at Berkeley, it is a requirement or prerequisite that you have a master's degree already. It's also oftentimes geared towards people who are mid-career. And so people who have been working already have really built up some of their career and want to go back to school for more training, and it incorporates a lot of practical leadership components. So really developing future leaders, people to lead organizations, agencies, et cetera, with this public health training.
Great, thank you. So another question. Oh, go ahead.
Oh, sorry. Just to speak with the PhD program at the Harvard School of Public Health. Yeah, so the PhD program, I think another thing to point out is funding. Oftentimes at Harvard, PhD programs are institutionally funded for 4 years. You get a stipend. And so that's something different, whereas DRPH, I think the funding is less guaranteed and not as much. So funding is one difference across different schools. Another thing I think is the length of time. So for our PhD is at least 4 years, whereas the RPH is 3 years, in which the first 2 years, like Kevin said, is coursework, but also the summers, and the third year is really about thinking about practicum and developing a thesis based on your practicum, whereas the PhD, you need at least 3 publishable papers by the time you graduate. And I think, and then for the PhD, they really pair you with a faculty advisor, and to develop and publish your research with.
Cool. So I'm seeing a question from Rengrode in the chat, and he is asking, what are some tips when applying, especially any tips navigating SOFAs? He's currently applying and submitting his applications for an MPH program.
So this is Sarah Diane Sadowski from Johns Hopkins Bloomberg School of Public Health Admissions Office. My first piece of advice for SOFAs is give yourself plenty of time. I'm sure you've discovered by this point the academic history transcript entry, which is just so fun when you have to enter every single class. We at Hopkins actually don't recommend that you pay for the professional entry because this can slow down your application from being complete and verified up to 3 months sometimes. So we really recommend that you do it yourself. Just sit down one night with your transcript in front of you, maybe turn on some Netflix. That's one recommendation. Also for SOFAs, really make sure that you're uploading the correct document per program that you're applying to in your program materials. Make sure you're actually in the program materials section. Make sure you're in the designation that you think you're in. We often find students upload the personal statement for a different school. So make sure paying attention to details like that. And then back again to that personal statement, that is your chance to really make you stand out from the actual facts. Don't talk about, don't give us a list of your resume because we've already seen that in your resume. We know what classes you took, but think about it as the English major, the inciting incident. So that moment, whether it was a moment in a particular class you took or working, kind of focusing your personal statement on your story of how you see yourself in public health and what started your passion for it.
Great. Okay, so with 1 minute remaining, I think we just have one more kind of last nugget of knowledge question. If you could offer one piece of advice to those considering an MPH or a PhD or DRPH, what might that piece of advice be?
I would say create a community around you when you are applying for these programs, because you will need recommenders and you will need folks to read your application and to cheer you on, because it's a lot of work. And to not underestimate the power of your story. Like I mentioned, I had a 2.9 and somehow managed to get here. So you can do it too.
I would say, I mean, again, just reiterating the passion, find what you're passionate about. And I think if you know what that passion is, then, you know, you will be able to articulate that in your statement of purpose. And I think that that will come off as genuine. And I think the admissions committee will see that.
And for me, one advice I would give is not to sell yourself short. I came in, applied to my PhD. I only had one peer-reviewed publication, but I had several grade papers working at the State Health Department, creating reports. And so that counts too. And so when they ask for any writing samples or any history of that, make sure you include everything that you've worked on, even blogs. Don't sell yourself short. But also remember that you're a Gates Scholar, and especially for PhD programs, if you can say that you bring in your own funding, that is such leverage that a lot of other students don't have in the applicant pool. So really see being your Gates Scholar status as a leverage, and say that up front when you're applying, because that is going to put you at the top of the pile.
Great. And I know that I said that that was going to be the last question, but we did get a great question from Michelle that I'm hoping that we can answer real quick before we end for the day. But she wanted to ask the panelists about how they feel about working with vulnerable populations and communities that have faced trauma. She's applying for graduate programs as a MS-PH or an MPH, and for in graduate programs. And while she's writing her personal statement, it's difficult to talk about the need to conduct epistemology research on international populations who are marginalized, and struggling with research interest, exotifying populations in need, and perhaps you can share some experience in research topics that you've worked on, and as Americans, how you were able to provide help to vulnerable populations without coming off as a neocolonialist.
I can speak a little bit on that. I think that's a really, really great question. And I think that one thing that's critical within public health and when thinking about how we work with communities is really reflecting on what your position is and where you're coming from. And you know, I think based off of that, it's really important to understand, you know, are you a researcher, you know, in some kind of Ivy League tower or whatever that's like coming into a community and saying like, I want to research on you, or what's the approach for how you're working with communities? And I think that that's really key is what's the community's involvement in the process? Are you engaging community in research, in you know, really identifying and addressing an issue and in developing solutions? And so I think that if it's the latter and there's really community engagement, then I think that it really benefits everybody.
That's a really great question, and a question that continues to permeate within public health and research the community, either overseas or domestically. I think for two things. So one thing is like align yourself with people that's going to challenge you in your assumptions. Constantly, we're always making assumptions, but I think the best thing you can do is be transparent about it in your research, in your conversations. So just create systems in which there's checks, right? You could talk to say, oh, here's my idea. What do you think about this? So you don't have like an echo chamber. You have people to challenge you to make sure you grow. And the second thing is that I think it's important for people to hear your story and why you're personally interested in that. Because I think oftentimes building up personal connections to say, like, I'm interested in exposures in nail salon industries, not because, because I witnessed it in my community. I have folks that I know and care about that are in this industry. And so oftentimes it's important I think to tell your own story and see what your connection with it and how people hear that story.
And then as someone that's working in global health at the moment, it is something that I struggle with all the time. We work mostly in East Africa, and I'm not from those communities. And I think that like when I was working at Seattle Foundation, there was more comfort around that because I'm actually was a resident of Seattle. But I think the biggest thing is trying to figure out how you can build local capacity, and that these people who are most impacted should actually be the ones who are doing this work. And also knowing that part of that also is giving up your privilege and also being willing to do the work to build that capacity to replace you in this role and being willing to give that up.
Great. Okay. I think that wraps us up for this afternoon. We're about 5 after the hour. So I first want to extend a huge thank you to all of our panelists today for taking time out of their days to offer their knowledge and expertise on the public health field. So we really appreciate you taking the time. We do have all of their contact information listed if you have some more particular questions for a certain panelist. So go ahead and take note of that. And yes, thanks so much to everyone. If anyone has any questions, additional questions, you can go ahead and put them in the chat, especially if they're GMS specific, and our staff can go ahead and answer those for you. And everyone else, enjoy the rest of your day or your evening, wherever you find yourself.
Thank you.
Thank you.
Whoever's the host, can you please stay on for about a few more minutes?
Yep, I'm on.
Yeah, I'm on too.
Thanks. Hey, Leandro, you want to take the Brianna's question?
I should think he was heading home because it's pretty nasty out here. It's dark.
Okay, I'll answer it.
Okay.
Are we free to ask questions through this, like through microphone?
Yeah, that's fine. If you have yeah.
So this one is kind of really specific, but what I'm doing is architecture, and I'm currently getting my degree in architecture, and I wanted to see how, I know that architecture can apply to public health easily. I wanted to go into health and wellness through it, but I was debating getting a degree in public health, like as a master's or doctorate, and I just wanted to know a little bit about that possible path after I graduate.
Yeah, Melissa, you'd like me to take this?
Sure.
Okay. So one of the biggest things when applying to public health or any graduate program, specifically that's like a public health, it's all about your narrative and how you sell your package. So even though you're an architect, there are skills that you've developed as an architect that you can apply that will help you to be a well-rounded candidate for a MPH program. It's just a matter of figuring out how you can navigate that story and tell that story. So, for example, if you were interested in public health where it's specific to what, give me an example of what you may be interested in.
Well, the way that we personally view it is the building's relationship with like the community, or like there's multiple ways that you can kind of look at it. You can look at it in how a building affects the people inside and how like it contributes overall. But it's a little bit confusing because I haven't really had someone to speak about the architecture side of public health with.
Sure. So one area that I can definitely see this coming into play is something with such as urban studies. Urban studies would definitely be where this would fall under. So what I would actually do is look into programs where there are public health programs that have a hint of urban studies, because that can help specifically about that community building piece. Also, community health would be a great concentration to navigate that opportunity. Again, it's all about how you tell the story, and it's really important for something like yours. It's very specific, so finding professors that are interested in that specific intersection. Does that help?
Yeah.
Yeah, and I would also look at kind of the environmental factors, similar to what Mizang was talking about, but environmental factors within public housing that influence specific communities, if that makes sense. But yeah, so she was talking about like environmental justice issues. Like she was talking about air pollution. So looking at how those environmental factors impact the public health of certain communities could also be an avenue.
Okay. Just it's definitely a jump. Oh.
It's not doable. It's definitely doable. So don't be discouraged.
Yeah, I'm sorry, I blanked on the time zones completely. It's 4 for me right now, so I completely like missed. But like, are you currently doing something similar to that?
So I'm actually staff, but I've worked with students who have jumped from hard sciences to public health, and also so maybe something from biomedical sciences or biomedical engineering to doing their MPH. So there are ways for you to do that. We also have a scholar who went from statistics to doing community health to then doing their PhD in health education. So it's definitely doable.
I hope to treat this as something that like I generally apply to my like architecture, although I'd be getting a degree in it also. I have a really particular case where I'm just jumping from like a master's of architecture to a master's of public health in that case. And I just hope that one doesn't make me feel like I hope by having those two things, I don't like alienate myself off out of another.
Mm-hmm.
I think it's really relevant because you can talk about built environment and public health, and that's a really big piece.
Yeah.
Melissa, would you be able to share the link?
Mm-hmm.
Thank you.
Yeah, if it's the administrative guidelines that you need, I can just send a link to the actual PDF document. Cool. So I just added the GMS admin guidelines. So that's available in the chat if anyone wants to check out the specific fields that are funded.
So just to get the little question that I had out of the way. So my current degree program is essentially like an undergraduate that ends with the master's. So I won't get funded for one of the years, but I'm not worried about that part. But would I just be able to like defer for that year that I'm not funded, and then go straight back into school for the MPH?
Do you want to take this one, Colin, or do you want me to take it?
Sure, I can take it.
Okay.
So how it works with, I'm sorry, here's Ziva, if you want to, our little, so how it works, so your question was how would deferment work for your master's, right? For that master's in architect?
Oh, no, I'm actually doing that right now. So like, not next school year, but the year after that, I will be not funded for that year. So I think I'd have to defer and then go right back to school afterwards.
Yeah, so it would be an academic deferment. The only question, and Melissa, can you help me out here? Since you would be receiving a master's, you would need to go to the next level, correct?
Yeah, yeah. So if you confer a master's degree, since you already have a master's, then your next level of education would have to be at the PhD level.
Ooh, what would that jump be like?
Yeah, so it would be, so you could, do a deferment for an academic deferment for the year that you're in doing your master's. So what that means, an academic deferment, or sorry, graduate school deferment. It's called graduate school deferment. So that's for students who are finishing up their master's in a non-funded area, or they need an additional year past the 2-year mark. Then what would happen is, since if you're interested in doing a DRPH or PhD, you could have the option of doing a public health deferment, which is up to 3 years. So that would be your option for, but you would need to be working in the public health field, and that would help you also to get your admissions. Melissa, also, can you correct me if I'm wrong here? Would a student also be able to do a transitional deferment?
Yeah, so if you have transitional deferment time left, if you haven't used any discretionary deferment time, then you could use that in addition to your public health deferment time in order to gain experience before you apply to that PhD program.
So 1 year transitional.
Mm-hmm.
Well, for Matthew, for you would actually do, since you are going to be in a master's program, you would be doing a graduate school deferment first.
Yeah, master's deferment.
Master's deferment. It's called literally master's deferment.
Mm-hmm.
Right now.
Yeah.
You want to take?
But then but then just real quick, if you use master's deferment for a year, then that is your, no, you get up to a year of that. So yeah, you can use that for a year.
Okay. And then, so that would be that 1 year that I'm finishing up my current program, because I haven't had a degree yet. This would be the first one. Mm-hmm. And then I'd have the 3 years after that year.
Yep, so you would use your graduate or your master's deferment while you're finishing up your master's. And then if you haven't used any of your discretionary deferment time, you'd have that year. And then if you're working in public health, you can do that for up to 3 years.
But Matthew, one thing to consider too, the scholarship is ending in 2029. So just keep that in mind, because you don't want to be in a situation where you defer, and then you're not going to get your full 4 years funded for a DRPH or a PhD. Also, the other thing to note is we'd rather see you back. One of the speakers mentioned this. If we'd rather see you back in school and you may receive funding from the school. So then you can then save your funding, GMS funding. So for let's say if your program's a 5-year program, so then you can use it for the last 4 years versus having to use it up front.
Okay, interesting. It's a really weird situation. And do you think that that's like possible? I mean,
For what, the deferment time?
yeah.
Yeah.
Well, I mean, not just the deferment time, but just making it possible to jump from like the Masters of Architecture to a PhD in public health.
I think it definitely is, especially if you take those 3 years or two to 3 years to work in the field, in the public health field, and finding something that really marries what just like the scholar speakers talked about, marries your experience of architecture with public health.
Yeah, and so try to do that by like this 2028 to 2029 school year. That's the last one. And then
Maria, I'm just real quick reading your question. Okay, Melissa, would you like me to take this?
Sure.
Okay, so Maria, your question's a great question. So when thinking about grad school, it's very different than how applying to undergrad is. There's no prescribed path. It's very different than when you are applying to law school or med school, where you have to have certain boxes checked off, and actually, or master's in engineering, and actually all of that is changing. It's on its way to changing. So even though you don't have a undergraduate degree in public health, the fact that you have a communications degree, which I was a communications major as well, so kudos. You can go into a public health as long as you have independent research in public health, and then after undergraduate degree, if you wanted to work a little bit in the field of public health, as maybe in a public health community health environment, or whatever your interests are, that will help you transition into a public health field. And so it also helps you to tell your narrative, and making sure you're pulling that communication studies degree into that narrative. It doesn't have to be that, okay, that was my part of my life as a communication degree in undergrad. You have to show, when applying to graduate school, you have to show the skills that you've developed over the years of your undergrad, as well as work experience, come together to answer this question of why you, why now, and why this school. And then the second part of your question, which is, how can I prepare to do a jump from bachelor's of communications to master's of public health? Yeah, so that's basically what I just said. Yeah. Any other questions?
Cool. Okay, so thanks again, everyone, for jumping on this afternoon. And let's say if you have any other remaining questions, you can go ahead and contact whichever panelist or staff member you need to contact. And then I also just want to plug that if you have even more in-depth questions, it might be helpful to reach out to your GMS partner office for some more one-on-one counseling in whichever area you need more information. All right, everybody, enjoy the rest of your day.